1.16 is a descendant lineage of XBB variant, a recombinant of 2BA.2 variant. XBB.1.16 was first reported on January 9th this year and was designated a variant under monitoring on March 2022 by the World Health Organization. This strain has been found in 31 countries including India, Singapore, Australia, the UK and the US. And in the US, it currently accounts for 7.2% of COVID-19 cases. Though WHO hasn't named it officially, but researchers and netizens are calling it Arcturus. So, is it dangerous? The new COVID variant is seen as a threat because of the speed at which it is growing. Dr. Rohit Kumar Garg of Amrita Hospital, Faridabad, pointed out that genome sequencing reports shows that XBB 1.16 has few additional spike mutations. It means that these spikes prevent protective antibodies from binding to them. Scientists at the University of Tokyo compared the Kraken and Arcturus subvariants, that is XBB 1.5 and XBB 1.16 respectively, have suggested that this new strain spreads out 1.17 to 1.27 times more effectively than its relative. This means it has a higher level of transmission than the previous strains. So this mutant strain of Omicron can easily escape immunity and infect people easily. Hence, it may be necessary to focus more on prevention. Is it reporting different symptoms?
There is a lot of overlap with other respiratory infections and other gastrointestinal infections also. COVID-19, as we know, can cause fever, muscle pain, joint pain, cough, breathlessness, and sometimes diarrhea also. With this current variant, we have found that conjunctivitis, which is also called as a red eye or a pink eye, has also become one of the symptoms for COVID-19. So patients who experience conjunctivitis along with a sore throat, body aches and chills could be suffering from COVID-19 infection, especially the current Arcturus variant.
The infection with this strain is particularly different from the previous one, as it has been reported to cause conjunctivitis or pink eye, especially in children below 12 years.
COVID-19 is more severe in extremes of age, very small children, people above the age of 65, more so above the age of 80 years. And people with immune compromised states, either because of medications like people on radiotherapy, chemotherapy, immunotherapy, and prolonged steroids or immune suppression because of any other cause like organ transplant. And people with severe medical comorbid conditions like kidney failure, liver failure, these are the people who would get a severe disease because of any pathogen and also with COVID-19. So they have to be more careful, keep your vaccination status updated and always follow COVID appropriate behavior.
Will your vaccination be effective?
In our understanding of COVID-19 in the past 3 years, we have found that COVID vaccines definitely help. It helps to reduce the infection, also the severity of illness. Even if there is not an exact match in antibodies, the cell-mediated immunity and also antibody-mediated immunity provides a background. So because of the presence of those antibodies, even if you get an infection, it will be less severe. So we should not worry that much that why take vaccination when virus is going to mutate. A basic structure of virus, the skeleton remains same and so is the immunity remains same. So yes, vaccination does help even if the virus mutates.
What preventions can you take? First and foremost, if you haven't already, then get vaccinated. Keep a physical distance of at least 1 meter from people. Avoid being in close quarters and crowds. Wear a mask. Ensure that your mask covers your lip, chin and nose. When you're done wearing a mask, store it in a fresh plastic bag. If you have a cloth mask, wash it and throw your medical masks in the trash can if it's made of plastic. Use soap and water or an alcohol-based hand wash to wash your hands. When you cough or sneeze, cover your mouth and nose with a tissue or a bent elbow. Dispose of your used tissue and do wash your hands afterwards. If you experience symptoms or get a COVID-19 positive test result, isolate yourself and consult a doctor. Before putting on your mask,